Battle there, a battle here over what to do with an area in and around the former Drawbridge Inn in northern Kentucky is not expected to be over anytime soon.
The Christ Hospital has plans to build an outpatient surgery center on the property. The medical reporter Liz Bonus joins us now to explain why those plans are now on hold. Liz.
Hey guys, good afternoon. Those plans are on hold after a legal challenge from St. Elizabeth Healthcare. They argue another outpatient surgery center in northern Kentucky is not necessary. And we did talk to both sides in this debate, which is not likely, as you say, to be over anytime soon. At the former site of the Drawbridge Inn in Fort Mitchell, the Christ Hospital has plans for what's called an ambulatory surgery center.
So what we would hope to build on that property is an outpatient center with an emergency room, diagnostics, physician services, really just offering consumers another healthcare alternative in the northern Kentucky area.
Kendall Herold says the Christ Hospital has assessed the need and patients want it.
Patients tell me and tell our physicians and executives all the time that they want choice in healthcare access in northern Kentucky.
But unlike where Christ's main hospital is in Mount Auburn, Ohio, attorney Mark Guilfoyle says Kentucky law requires you prove patients don't already have enough of these services if you want to provide more of them. He represents St. Elizabeth Healthcare, which has challenged this point in court. So it seems that there's some discrepancy over something called the certificate of need. What is that?
So in order to build a new health facility in Kentucky, the provider has to prove that there's a need for that facility.
St. Elizabeth argues that there are already 9 centers in northern Kentucky that are not at capacity and offer similar services to the one Christ wants to build.
Of the 9, 3 are independent.
Guilfoyle points to birth control procedures. Tubal ligations, for example, are not provided by St. Elizabeth Healthcare because it's a Catholic hospital. They are still available, however, for women through an independent facility.
There are actually 2 OBGYNs in northern Kentucky, unaffiliated with St. E's, who are performing sterilization procedures at this independent surgical facility.
Guilfoyle says St. Elizabeth Healthcare sees a greater percentage of patients on Medicaid and Medicare than the Christ Hospital does in its offices in Fort Wright.
So what they're really saying is we want to come over and compete, but we want to take the paying commercial insured patients and leave St. Elizabeth to care for Medicaid and those who can't afford to pay.
When I asked Kendall Herold about that claim, her response?
That's absolutely not true. The Christ Hospital and our physicians accept all forms of payers, including Medicaid. And quite honestly, for St. Elizabeth to suggest otherwise is really misleading to those consumers and patients in northern Kentucky.
A debate not likely to end anytime soon. The certificate of need decision could come down anytime between now and June. However, both sides point out that no matter who ends up being ruled in favor of, the other side will likely appeal. And that will still take more time.
I always thought you could just build because you wanted to build. I didn't know they had to go through all that, you know.
Keep in mind, Ohio and Kentucky have different rules, different laws, and this is unique to Kentucky. It's called the certificate of need. There's been, they said, 26 of them that they've had in Kentucky, and St. Elizabeth said they've only challenged 2. So they do a lot of building, and this is just one they felt that didn't meet what they felt there was a need for.
Okay.
All right, we're going to be back at 5:30. Talk to you about a breakthrough with a child with autism.
All right. Great.